Pre-Med Solutions, and we want to welcome you to another one of our exciting webinars and where we're trying to help you all get into medical school. So we are very excited to have the two presenters that we're going to have today. We're going to let them introduce themselves in just a few minutes. Today, this might be one of the most important parts that we're going to talk about, one of the most important presentations. We're going to talk about how to strengthen your application. Unfortunately, most of the students that I get referred to me need to figure out how they can strengthen their application. And so we have two experienced admissions officers and faculty members and deans that they're going to go through some topics, and hopefully we can answer your questions for you. So first of all, we're going to have Dr. Minka Schofield. And why don't you go ahead and introduce yourself, Minka? Dr. Schofield.
Hi. So I'm Dr. Minka Schofield. I am an associate professor at The Ohio State University, and I am in the Department of Otolaryngology, Head and Neck Surgery, and I serve as the co-chair of the admissions committee for our College of Medicine.
Good evening, everybody. My name is Dr. David Rose. I'm the Associate Dean for Student Affairs and Admissions at Howard University College of Medicine. I'm an associate professor in the Department of Surgery. I'm a vascular surgeon by training, but majority of my time for the past 3 years, since 2017, have been spent in admissions and student affairs.
All right, so first we're going to have Dr. Schofield give her presentation.
Okay, can you hear me?
Yes, we can hear you.
Okay, so I will, as Dr. Jones talked about, discuss strengthening your application. There's some specific topics that I wanted to highlight. One, I wanted to talk about your GPA and MCAT preparation, and just discuss some ways in which you can try to help improve your metrics for your application. Next, I'll discuss a little bit about your letters of recommendation and how to go about asking for strong letters. Then review some of the key extracurricular activities and how which activities matter, what are we looking for. And then lastly, just mention a little bit about the diversity factor and how this can play a role in your application. So everyone, when we talk about, I want to go to medical school, the MCAT is like this big kind of threat, this obstacle that we're all worried about. In addition, there's this heavy science load, and I think it's important to just remember, you got this. There are plenty of people that have done this before you, and you can do it as well. So this is just an example of a metrics type transcript that you can find on an AMCAS. Basically it shows all of your grades, like your GPA for your freshman, sophomore, up to senior year, and you both post-baccalaureate GPA, graduate degree GPAs. I want to point your attention to the fact that the GPA is divided into all others and BCPM, whereas BCPM is mostly like your science courses, biology, chemistry, physical sciences, and math. And then you have all others. So when you're looking at some of the weaknesses of your application, you want to see where those weaknesses are. Is it primarily with the science? And then you have this all others category that's kind of padding it, making your overall GPA better, or can you pad it further, those kinds of things. And then your MCAT scores are listed as well, and the schools do have access to prior MCATs. And so it will be listed. And so this is what the school will see. So before we dive a little bit deeper, oftentimes people go, well, you know, my metrics aren't very strong. Should I do something to improve my GPA, or should I do something to improve my MCAT? And I think, one, we need to understand why these metrics are important. People are trying to judge, admissions committees are trying to judge whether or not your prior academic performance or your performance on the MCAT can be a good indicator of your potential performance in medical school. And so it is a way to weed out those that potentially may not perform as well. And we recognize that this is not the best way to assess this. So looking at the GPA and the MCAT independently is probably not a good predictor, and there's evidence that suggests this strongly. That if you want to look at the metrics, then you probably should consider these together. So if you have a weak MCAT, you should probably consider improving the weak MCAT. If you have a weak GPA, you should probably consider strengthening that. So I don't think of them separately, think of them as a combination. Neither one is a predictor though. So how would you strengthen your GPA? Well, I think it's important, once again, to look if you're weak on the sciences, then perhaps you should take some additional science courses to show that you can perform science curriculum. If it's just that you did relatively well, so let's just say for my school, anything less than a 3.2 is considered an area of concern for a GPA for the Ohio State College of Medicine. So when you go through and you look at the different schools that you're applying to, look at what their mean GPAs are or what their minimum requirements are. And if you find that overall your GPA is lower than most schools, you might really want to consider how can you improve that, whether it's the BCPM or just taking additional courses. Another way that you can pad your GPA or improve it is by obtaining a master's. And sometimes people do this to show that they can do more graduate level work. Like, hey, my undergraduate performance perhaps wasn't the most stellar, but let me demonstrate to you how I know that I'm capable of doing this level of work at this degree. So not just one course, multiple courses. And in addition, you get a master's. Lastly, attending a post-baccalaureate program or these med prep programs. And these programs are designed to try to help you figure out how you learn, strengthen your GPA, and hopefully kind of supplement or at least negate the past GPA. When we think about the MCAT, it's divided into 4 sections, and I want to go through so that as you're studying, you understand how you should be processing the information and what will be required of you from each section. So when we think about the biological and biochemical foundations of living systems, this is essentially looking at your understanding of biology and the biochemical sciences, but scientific inquiry, reasoning, research, and statistical skills using that knowledge of information. So when you're studying, it's just not about remembering the key points, it's about how do you apply them. And so just remember that. And this goes for chemical and physical sciences too, similar thing. For psychology, for this section, it's looking at psychology, sociology, biology, research methods, and statistics, and basically trying to ascertain what your foundational understanding is of behavioral and sociocultural concepts. And so when you're studying this may be more of a memorization type thing, but really understanding the information that you're learning. And lastly, CARS, or critical analysis and reasoning skills. This was previously the verbal reasoning category. And this section is designed to see how you, to assess your analytical skills. How can you read a passage and use the information that you've read to apply it to answering a question? So comprehension, evaluation, application, and how you incorporate this information. So what's important here is previous to the recent MCAT, this score, the verbal reasoning score, was oftentimes used as a measure to determine also your ability to perform in medical school. We're not quite sure how the CARS correlates, but many people, particularly people that have been on admissions committees for very long periods of time, look at your CARS score pretty in-depthly. It's also important to know that you don't have to know the information. You need to know how to read complex paragraphs, gain the information, and apply it. So this is the MCAT and how it's scored. 500 gets you at the 50th percentile. The new MCAT has a shorter range, so you can make small changes in your overall score that will change your percentile more significantly than previously, but the same goes for missing questions can change your percentile more significantly. I wanted to show you this diagram of a score sheet. And so if you look at this particular example, the person scored below the 50th percentile in psychological, social, and biological foundations. So when you're going back to study or retake the MCAT, you want to look at what some of these weak areas are so that you can focus a little bit more of your attention on the weak areas. You still got to kind of review the other information, but honing in on those weak areas is key. So how do you strengthen your MCAT? Well, I mean, if you think about it, there's a lot of information that someone's trying to cover in a single sitting of a test, where you've taken courses over 2-3 years focused on this science material. So you pretty much should try to do well in your science coursework. It is really hard to learn new concepts at the volume in which you need to learn it to study for the MCAT. So try to do as well as you can in your science coursework so that when you're studying for the MCAT, it's more of a refresher, maybe filling in some gaps of information that you didn't learn, but not to just revisit physics all over again. When you're preparing your study schedule, make sure it's realistic and have and actually prepare a study schedule that you stick to. This is very important to make sure you stay on task and that you're very disciplined about reaching your goal of obtaining all of the knowledge that you need to for the MCAT. MCAT prep courses, things like Kaplan and Princeton Review. These come with a price tag that can range up to $1,500, $1,600, so they're not cheap. MCAT study guides that you can purchase or other ways that you can prep. Question banks, I think these are very key. I think once you have a basic foundation for the information, testing yourself on how you interpret questions, dissect them, and can get them down to just even 2 answers, it's very key. And so questions are very important. And so UWorld is one resource for that. Post-baccalaureate or MedPath programs I've already talked about. My program in particular at The Ohio State University College of Medicine is the MedPath program. And one of the key things with this particular program, not only does it allow you to take additional science courses to prep you for med school, but it also takes you through a process of preparing for retaking the MCAT using Princeton Review concepts, and it's all included in the program. So if you can find a program that kind of does both, that's great because you have that support there. It kind of forms a guide for you as you're taking the MCAT. I think the most important thing is don't open up your envelope, see your score and go, oh, when is the next test? I think that's the biggest mistake. You have to pause, think about what you did, be honest with yourself, what was wrong with your process, change your process and how you can improve your performance based on modifications in that process. So don't retake without changing your process. I included this slide because I think it's important because not everyone comes from the same socioeconomic background, and by no means does that mean that you don't need to at least have some of the same resources and opportunities as others. And so there is a fee assistance program that the AAMC has on their website that talks about how you can obtain free MCAT prep products, how you can get a reduced price for your MCAT exams. Also, you would get a complimentary subscription to the medical school admissions requirement, the MSAR, where you can go in and look at all of the requirements of schools and understand what is required of you to apply to that school. And then there's also an AMCAS benefit where your fees could be waived up to 20 schools. So next we'll talk about the letters of recommendation. I think the most important thing you should understand is relationships matter. You can't spend your time in college going from class to class without developing relationships with your professors. This can become extremely challenging when you're in some of those intro to bio classes or other organic classes where these classes are huge. And maybe you won't be able to make a relationship or form a relationship with the professor. But if you are a science major, there obviously will be other opportunities, right, to get out of some of these core pre-med classes. But if you are an English major and your only science work is going to be some of these classes, you've got to make a concerted effort to develop a relationship. And so this may be your professors, preceptors, advisors, employers, supervisors. Many schools require at least 2 professor letters. We require at The Ohio State 2 professor letters. One of them at least has to be from a science professor. We encourage additional letters from other people that have maybe interacted with you, whether shadowing experience, volunteer experience, research experience. So really think about this wisely when you're going through your coursework. If you can, am I going to go to TA hours or professor hours, those hours where you can go and talk to them about the class, so they can put a face with the name and develop a relationship with you. I always encourage students to introduce yourself, especially in some of these smaller classes, and even share your plans for attending the medical school so people can keep you on their radar. It's a great way to initiate that relationship, and you never know, someone may actually take an interest in you and offer you opportunities or throw your name out as someone to consider. The other thing is bank a letter of recommendation. So I talk about at the bottom, after you've completed the experience, the course, the volunteer experience, and you feel like you want to ask a person for a letter, do it immediately and ask for the letter in person so that you can have a conversation. That is the best way to do it. This day and age where we're virtual, I've had many students even request a virtual meeting with me so that if I don't remember their faces, I at least get to see them again and have a conversation that's somewhat face-to-face. After you obtain the letter, bank it. Try to use this letter so that in current day, obtain the letter in current day so that 2-3 years later, you're not asking for a letter and the person doesn't even remember you. Always provide a personal statement, your personal statement, and a CV or a copy of your AMCAS application, your resume, so that people can see you on paper, have an idea of who you are and the experiences that you have participated in thus far. So I thought I would include some examples of letters. These are real letters from people that applied. We did get permission, and I use this in the course that I teach that's Intro to Medicine at The Ohio State Wexner Medical School. But I want to show you what letter writers will send in on your behalf if they don't know you. So I'm going to look at the second paragraph. Blank earned in a blank in each of the courses. She occasionally came to office hours joining in on our discussion. She did not ask me to write this letter in person, so it is difficult to really see how she has grown over the past 3 years. She shared her information by email. Her MCAT score is blank. She has been working at blank, working full-time over the summer. She has been involved in a research lab for the past 2 years working on blank. At this point, I am torn. I wrote over 300 letters a year and always make time to sit and talk with students, as the above facts are the things you know from her application. I hope her application includes letters from recent professors, people she has worked with in the lab, or supervisors from blank. My recommendation is to look at her complete application to see where she stands versus other students applying to your program. This is a real letter. Okay, this is not a favorable letter. This is another real letter. Okay? To whom it may concern, I have known blank for 5 years. Blank took 5 biology courses from me. Blank also conducted research with me in my laboratory. Blank's performance was adequate. Feel free to contact me by phone if you require any additional information. Sincerely. This is probably someone who took one of those large biology courses and just never connected with the professor. The sad thing is they took additional courses and still never connected, really. So this probably wasn't the smartest thing to ask this particular professor for a letter. All right, so then we'll move on to extracurricular activities. My advice here is to choose wisely, especially if you are reapplying. You've got a lot to balance. You've got to focus on how do I improve my academics, but how do I also continue to show that I have an invested interest in medicine? And so we always look at gap years. How are people using them? And if people are not using them and still demonstrating that they have an interest in medicine, it almost is like, is this person serious, you know? And you can be very serious, but people want to see that continued effort. So community service, kind of your standard activities that you think about, like Habitat for Humanity, all the organized organizations where you can go and just volunteer your services. I put volunteer experience as a separate one. It still falls under community service, but it may be that you decided to tutor someone out of the goodness of your heart, not some formal community program, but you're doing this to help your peers in some way. Leadership experiences, these can be both formal, so I was the president of X, or I was elected to this position. Or it could be informal, where you may work in a lab and you are the lab lead and you help introduce other undergraduate students to the lab. But I think when you're writing up your application to make it as strong as possible, you have to delve deeper and figure out, how do I highlight that I'm a leader? Because it's important. And especially at The Ohio State University College of Medicine, we're looking for leaders, people that have shown that they have a path of being, of leading a group. If you have taken care of a family member that is ill, or you have your own personal health experience, that's always nice to share. It shows how you've interfaced with the medical, with medical care. Healthcare related experiences, this really isn't much different from your volunteer experiences or community service on AMCAS. But at our school, we like to pull this out as a separate category to really understand that you understand, or at least get an idea that you understand what you're getting into, that you understand what medicine is about. You have a clear picture. And so lots of times people obtain this through shadowing. Shadowing experiences are extremely hard to get these days, and we understand that. So a lot of people are doing other things, and like becoming a scribe. They volunteer at a healthcare facility. They do other things, nursing homes, working with like autistic kids, or being home health aides, things of this nature, so that maybe it's a work experience, but it's also healthcare related too, so that they can get that exposure. Research experiences, I tell students you don't have to have research to get into medical school. Is anyone going to fault you for having research? No, it always adds. It adds to your application, but not having it doesn't mean you don't get in. I will tell you, with the competitive nature that of medical school, if you do have it, it's definitely a plus. This can be bench research, this can be a clinical research activity. If you've done a poster, paper, presentation, that further adds to the application. And then lastly, utilizing your summers to the best of your ability. There are tons of summer programs and internships that you can be a part of. And if you can't balance a lot of these activities during the school year as well as you would like to without your academics suffering, try to optimize your summertime by doing something that helps your application. So I thought I would include this because this is an example of a scoring system that we might use when screening an application. And so we look at, for healthcare related particularly, we're looking at hours. And so this is just the categories divided. And obviously one would be best in this particular scenario. And so essentially we look at the amount of hours that someone has committed to something and add it up, and they're given a score for that. What I don't want to encourage is for students to go out and start doing check boxes and saying, got that, yep, these many hours. That's not as important as you being passionate, having some passion about what you're doing, that you find it interesting, it's making a difference to you, it's impacting you in some way, it's solidifying that you want to serve by through medical care. So even though we do this when we're going through, I think it's more important to look at the experience. I love longitudinal experiences where someone has dedicated years to something. They may not have a lot of experiences, but they can tell you where they've been spending their time, and you feel the passion when you talk to them about it. So do's and don'ts for extracurricular activities. I just talked about choosing an activity that you're passionate about. Try to kill two birds with one stone. You know, if you're going to be in an activity for a couple of years, at least become a leader in it, so you can kill that stone. If you have to work, try to get a job where you're employed in some healthcare facility, so you can say that you had that exposure, but you're working too. Avoid checking boxes. Establish the relationships also when you're doing these extracurricular activities. You can get a letter from someone you've shadowed with or a volunteer experience. Start early. I think one of the challenges is people decide to go into medicine late, or they don't recognize the importance of being involved. And so they're trying to scramble and get things together so they don't have the hours. They got all of these little mini experiences, and you can tell when you go through the application that this is just checking boxes. The person isn't really vested in the activities. And remember to continue them during your gap year to keep your application strong. Describe the activity, your role in the activity, and how this activity has impacted you. I don't know what your activity was. And in order for you to bring the importance of it to light, you've got to describe to me what it is and why it's important. And don't sacrifice your academics. And then lastly, I want to talk about diversity matters. Everyone benefits from diversity. And the quicker you learn that, the more you will feel almost empowered to talk about why you are unique and why a school needs you in their program. So what are some of the benefits that we know about diversity? Underrepresented minorities are more likely to probably practice in underserved areas. Mentorship relationships are probably more effective when people are being mentored by individuals that look like them or have a similar background as them. We know that diversity promotes research and innovation. It also helps bridge cultural gaps in the delivery of medicine, so helping reduce some of those healthcare disparities. And also when you're having a diverse environment, this helps bring about awareness of that other group. And it helps us all overcome some of our unconscious biases that tend to play into how we treat patients and how we interact with colleagues. There are multiple types of diversity. And so when you're going through your application, it's just not limited to race and ethnicity or even socioeconomic. But if you've had challenges because of your race or your economic situation, then that might be something that you can highlight. And there's opportunity to do that on the application. Any kind of gender challenges that you think may have impacted you in a way that has further encouraged you to go into medicine. Age, physical disabilities, or even sexual orientation. All of these are part of what makes you diverse. And if you can present these in a positive light, I always say positive, this will benefit you. If you're a first college graduate, people love first college graduates. Why? Because it means that you have a drive unlike any other when it comes to trying to come from not knowing to knowing. Perhaps you've had to work a little harder. Maybe you didn't have the support system. Maybe you didn't come from the economic background. And so it's implied that you may have had to work a little bit harder. First generation immigrants or DACA students, same thing. People love non-traditional career pathway students as well. So I was a lawyer, now I want to be a doctor. Or I was an engineer, now I want to be a doctor. I was a ballet dancer, now I want to be a doctor. People love that. And so that adds to the diversity as well. We love diverse majors. You don't have to major in a science. So diverse majors are also very interesting. Athletes, hobbies. There's places where you can put things like your hobbies or interests that you have as extracurricular activities. It makes you seem more well-rounded. And then any kind of distance traveled. I think there's a part of the application where you can talk about why you were disadvantaged. And for some students, they may say, well, I had to work 40 hours a week while I was going through college because I had to support my family as I went through college. You know, I wasn't able to just go to school. I had to travel 2 hours back and forth to college because I couldn't afford to live on campus. I'm a first generation immigrant. I had to learn English before I could go to school here. And I felt, you know, whatever the issue is, I'm making them up off my head. But distance travel implies that you had to overcome some obstacles unlike someone else or not like the majority of people that makes you unique. So I'll end here and I'll turn it over to Dr. Rose, who will talk to you further about strengthening your application.
Thank you, Dr. Schofield. And as we're changing, we're going to try to answer a few questions. And depending on whether or not we can do this smoothly, we like to see your faces when you answer the questions. I saw some really good questions come up on the chat. So we're going to try and see if we can get some of those. The first one, Milan Chef. Milan, do you want to answer your question? Ask your question?
Hi.
Hey.
Are you guys able to hear me okay?
Yeah,
Yeah.
we hear you.
Okay, great. Thank you so much for the presentation.
Tell us where you're from.
So I'm actually originally from Ohio. I went to The Ohio State University, graduated in 2012.
Sorry to hear that.
I did a couple years of clinical research and then completed my post-bac program at Eastern Mennonite University. And I've worked as a medical scribe for the last couple of years and continue to do some clinical research. So I had some unforeseen circumstances in undergrad taking care of my dad while he was ill, and I was not able to perform as well as I would have liked to in these prerequisite courses. And so I took some online courses, and then I knew that I still needed to see that upward trend. So I completed a post-baccalaureate program for like biomedical sciences. So I graduated with a Master's of Science in biomedical sciences. And so my question for you is it okay that I took those upper divisional courses, but I have some classes that are also prerequisite courses that I took online?
Yes, I think that's acceptable for sure. I don't think that's any different from someone deciding to, well, definitely in this day and age where people are taking virtual courses. So I definitely think that works in your favor. But we have students that worry about, hey, I took this course at a community college or what have you. And so people worry about the strength of the school or the strength of how they obtain the knowledge. I think in your particular case, it's been a while since you've been in undergrad, since 2012. And for you to be able to demonstrate that since then you were able to take additional coursework, you've done a post-bac, I'm hoping you strengthened your GPA in that coursework. I think people are going to look at that. And I think your experience with your father is probably something that should either come up, perhaps not grades, but just the experience itself in your personal statement or during your interview, so that people have a greater understanding of kind of your path.
Sure. Yeah, I've definitely included it in my personal statement, and then I've kind of with my narrative, I've kind of explain kind of what my journey has been. So thank you so much.
Thank you for your question. We have a similar question, but I think it's important to ask, coming from Danae Easy. Danae, do you want to ask your question? And Sheth, if you could turn your camera off for us, we'd appreciate that, and mute yourself.
Hi. So my question is, I know that master's doesn't reflect in the BCPM portion because it's a master's coursework and an undergraduate coursework. So let's say, I remember you stating that something below a 3.2 would be a concern for admissions counselors. So let's say if I had a less than a 3.2 in my BCPM undergraduate, but then I had a 4.0 in my master's, would that still be a concern, or would, because I went and showed that I can handle coursework at a higher level, that would kind of outweigh the concern of the lower BCPM GPA? Because similar to the gentleman before me, I graduated in 2012, so there is no way I'm going to improve my undergraduate GPA significantly because, you go so.
Well, okay, so first thing, just to be clear, 3.2 is for the Ohio State.
Right.
Everyone has their own cutoff. And so for us, it's less than 3.2. We definitely would look at your graduate. You said it was a master's in what?
I just did the physiology because you mentioned
Okay,
it.
master's physiology, same thing. Those programs are designed to help get you into med school. And so, yes, I think we would probably focus more because of that time difference. But two, I mean, if you've got a 4.0, I mean, no one can deny more graduate level work and you aced it, So no one's going to look back. I mean, we acknowledge it because it's a part of your transcript. But when looking at who you are today and what you've become or achieved, that's probably more important after 8 years.
Okay, thank you.
Thank you. Dr. Rose, you want to comment on either of those two questions?
No, I would definitely agree. We would also kind of look closely at the specific courses that you took during the master's and getting the master's to determine if it kind of correlates well with the medical school coursework, and it's not just, for lack of a better word, like a fluff type course. So we would kind of just scrutinize the exact courses that you took within that master's, but absolutely, I would agree with Dr. Schofield. You get a 4.0 in your master's, and we're going to look, very closely at that for somebody who's been out of school a while, because that's the most recent representation of your science work.
Okay. And I think, and Dr. Schofield mentioned something very important too, which is sometimes gets lost in this whole admissions process, is you have to apply to the right schools, depending on what your credentials say. And so for some schools, a 3.2 would be pretty good. So don't sell yourself short, but you have to apply to the right schools. Here's another quick one. If we can get a quick answer to this one, because I think a lot of students aren't aware of how this works. From Alyssa Love Archie.
Hello. I was wondering, okay, so I graduate in about 2 to 3 years, and I just want to know if I did get a letter of recommendation from a professor, like Ms. Schofield said, like if I get one now and I ask for one once the course is over, how would I bank it? How would I put it on my application if I'm not applying right now?
And I want to add the other part of your question, which is that I definitely want them to answer is, would recommenders give the letter directly to us, or would they send it directly to the AMCAS website?
Yeah.
That's something that a lot of students don't understand. So can you all just talk about that briefly?
Yeah, so first, there are some institutions actually have a place where professors, if they write you a letter, they can submit them to kind of like a database. And some institutions don't have that. There is a, you can ask for the letter, and you can ask for the letter, and then they save it, but they write your letter. Do you understand what I'm saying? So they bank it themselves because the letter doesn't come to you. The letter goes directly to AMCAS. And so most people recommend that you waive the right. So let me just backtrack. Let's just backtrack. So most people recommend that you waive the right to see your letter. Okay. So the professor will write the letter and you don't get to see it. All right. And then they write the letter and send it to AMCAS. And that's how it's loaded. All right. So you don't get to see that. What can happen?
Before you go, what about a student who does not waive their right to see it? How is that viewed in admissions committees sometimes?
You know what? I don't know if I've ever seen a letter that hasn't been waived. Dr. Rose, have you seen one that?
I think I've seen it probably once or so, and the way we would look at it is that letter would be put to the side, because we know that since the student viewed it, they submitted it specifically because they're happy with the letter, and we want a letter that that there were no biases attached to it. So. I agree. You should waive the right to see the letter. But I think one of the things that Dr. Schofield brought out in her presentation that is most important is that relationship piece. Because if you don't forge that relationship, then you're going to be feeling uncomfortable about them writing that letter for you. So don't ask if you're not sure about that relationship that you developed with the professor.
Okay.
One of our students mentioned that there's a great site called Interfolio that you can use to keep all of your letters of recommendation. Let's go to another one quickly. And while we're looking at that, I'll just wait. I'll make that comment at the end, something I do with my letters of recommendation. I saw some really good letters. I think you have a sick family member. Microaggressions. Yes, we have that. We probably don't have time to get into that right now. Here's a question specifically for Ohio State. Does Ohio State use the last MCAT score or the highest score? And for Howard too?
It depends on how close they are.
Okay.
So if you took an MCAT 2012 and you took it again in 2016, we get all the scores, but we probably will look at the most recent score. But some students, like I told you, they'll take it back to back, 6 months apart or what have you. I'm looking at both of them and I'm probably averaging them.
Yeah, we look at MCATs over the last 3 years, but we will tend to favor the most recent. And similarly, if they've taken it really close together within months, then we kind of look at both.
Do you look at any one section more than the other?
So we have not broken it down by the sections to show that there's a correlation with our first or second year performance based on the sections as yet, but that's just because we haven't, kind of pulled that data. I do know that of other schools that will look at individual sections, like the bio, or they may look at the CARs. I know, speaking to one of my colleagues, I think in New Jersey or so, they won't interview somebody who has a CARS below 124 or something like that. Now, how they came up with that number, I don't know, But I think each school would obviously have the ability to crunch their own numbers and see if it correlates with outcomes in the first couple of years, or maybe linking it to performance on step one and things like that.
Let's hear one more question from Dr. Schofield. You had a comment?
I was just going to say we don't look at any one area. Someone asked what the cutoff. Anything greater than the 49th percentile is considered.
Okay. Well, listen, one more question from Mackenzie Thomas. I kind of glanced over that before, but we know microaggressions is a big problem right now. So, Mackenzie, do you want to answer your question? Ask your question?
Hi. Thank you guys for my question. So I just wanted to know, as underrepresented minorities, in the workplace, how have you guys kind of navigated through, handling microaggressions in kind of a professional way and not necessarily reacting, but kind of educating in a respectful manner?
Mm-hmm. And where are you from, Mackenzie?
Oh, I'm from Savannah, Georgia. I go to Georgia Southern University on the Savannah campus, and I'm a sophomore.
Okay. Thank you for your question. Any of you want to handle that? It's a big problem these days.
From African American female in a surgical specialty that highly underrepresented. I think you have to choose your battles. I always demand respect. And I think I worked very hard to get where I am, and I should be respected by others, but I also choose my battles because I can't fight every single microaggression. But I do take a stand when I feel that it is most essential to who I am as a doctor, how I provide care to my patients, and how my colleagues should respect me as just a fellow, colleague. So I do take my stand, but there are times, people will go, I can do the trach. You don't have to worry about. I'm like, I got it. And they're like, oh, but I have it, and it's just this. I don't know. It's this thing that happens. People don't know they're doing it, but they're implying or suggesting in some way that perhaps they're better or they can handle the situation better. But I think just standing your ground and knowing what your skill sets are, and being confident in who you are, and demanding that respect is extremely important.
Anything to add on, Dr. Rose?
So it's a little bit different for me, obviously being at Howard, which is a predominantly African-American institution. So if you think about the microaggressions from the standpoint of sort of a racial thing, that is not going to be a big part of my day-to-day life. But trust me, just, being in administration, being a surgeon, dealing with folks, you're going to have, I guess, what I call micro frustrations, which at the end of the day, can lead into just you kind of feeling like totally worn out. But I like Dr. Schofield's approach. You got to kind of pick your battles and decide which things you're going to let run off your back, versus letting it just kind of pile up. So at the end of the day, you're totally frustrated. But I think that's just going to be part of life, whether you're in a situation that is dealing with gender microaggressions or racial microaggressions or so. Even when those pieces are not in place, just, the usual frustrations for me as a surgeon, getting your case posted at the time you wanted to get it and interacting with folks and so on. There's a whole bunch of stuff you could let get under your skin, and you have to learn to kind of roll with it. Obviously, it's much more frustrating when it is based on race or gender. That, just takes it to another level.
Just audience, so that you all know, you are fortunate to have 3 surgeons in your midst. All 3 of us are surgeons, so we're being humble. That's something that we're not usually used to doing, but we're all being kind of humble this evening. So, and Mackenzie, just to answer the last little part of your question, you asked how would you approach someone for shadowing opportunities, and that can be very difficult, especially depending on where you are. And if you're a minority asking for a majority position, a lot of times for shadowing opportunities, they aren't willing to do them. So again, it's back to what Dr. Schofield says, it's all about relationships, and you have to kind of try to develop those relationships and utilize different strategies. But it can be very frustrating and very difficult, but don't give up, because you have to have some shadowing experience in order to get accepted. Before we go to Dr. Rose, last I want to comment on with Dr. Schofield's comment. I'm so happy she talked about diversity, because that's very important today. And I like to say there's schools that have diversity because they want to, and there's schools that have diversity because they have to. And Ohio State is one of those schools that has diversity because they want to, and it shows in their acceptance rate and how their students are finishing. So you want to be sure to pick a school that is diverse because they want to be diverse. We talk about the cultural fit, and that doesn't necessarily mean race or culture in that way, but just would you fit in there? So there are a lot of things you have to consider. We're going to have a session on picking the right school, so we won't dig into that anymore. But diversity is very important. Next, we're going to go ahead and Dr. Rose, tell us who you are and what you do.
All right. So as I mentioned before, my name is Dr. Rose. I'm the admissions associate dean for student affairs and admissions at Howard University College of Medicine. And Dr. Jones asked me this evening to just share a couple of things about taking a gap year and how we look at master's and post-bac programs. So my presentation is fairly brief, and here's my outline. I'm just going to talk a little bit about should a student take a gap year, and incorporate into that a little bit about master's programs and post-bac medical programs and how we actually view them. And again, I've been a student affairs and admissions dean for the last 3 years, so I consider myself kind of fairly new to the admissions process. So my comments, you have to kind of take them in with that regard. So should a student take a gap year? So I think the first piece that you have to do is really a critical review of your own application. And Dr. Schofield kind of nicely outlined, the things that admissions folks are going to look at, admissions directors, admissions committees, and so on. And they're going to fall really within your academics and then your experiences. And she outlined a number of types of experiences that we consider important, particularly the healthcare associated experiences that are in your application. So when you're thinking about, well, should I take a gap year? To me, one of the first things that you need to do is to just sit down and look at your own application and say, where do I stand? Where do I stand with respect to my academics? And where do I stand with respect to my experiences? Do I feel like I'm putting forth the best application for the medical schools out there? The next piece is to engage your pre-med advisors and their mentors. I think this is something that's just underutilized. It's not surprising to me sometimes that we get questions from students and that it really suggests that they haven't either sought out their pre-med advisor or sought out some mentors in the field just based on the types of questions that they're asking. And then remember that we're in a digital age, so there's just a lot of information out there. And yes, sometimes it can be very just a whole lot of volume to deal with. And I would really suggest, utilizing the AAMC as a real good starting point. They have so much, just a wealth of data on that website about the process of getting into medical school. So use things like the AAMC databases and the MSAR databases so that you can get a good feel as to, what medical schools are looking at. Dr. Schofield mentioned, for example, what their cut point for the MCAT is, or what their BCPM, types of BCPM would be concerning to them. For us at Howard, our MCAT cut point is 494, but the class average is somewhere around 503 to 504. The BCPM, our class average is about 3.3. We get concerned maybe if the BCPM is less than 3. So, you need to kind of do your own research, go onto the medical school websites, attend their open houses so that you get an understanding of what each school is asking for. And then you can factor in these things into answering the question, should I take a gap year? Because if you take a look at 15 schools that you're interested in and you feel that your application is not up to par with these schools, then maybe it is a decent idea to take a gap year so you can strengthen your application. So again, it's not a one-size answer that does not, one-size answer does not really fit everyone. So you have to, again, ask yourself why. Some people may consider taking a gap year for personal reasons. They may decide that, hey, after 4 years of undergrad and sludging through all those, those science courses, and I did my volunteering and my shadowing and so on, I'm just pooped. I just need a break. And you may decide that, I want to travel for a year, I want to, or maybe, just rest and rejuvenate and so on. And that may be your rationale for taking that gap, and that's totally fine. Let me just interject here and throw one statistic, at you. So at Howard, I would say over the last 3 to 5 years, the average student in our class has been out of college about 2.5 years. It's a big range because we have a BSMD program where young students come right in after 2 years of college, and we have people who have been out of school 6, 7, 8 years. But on the average, it's about 2.5. Another piece that may, push you towards taking a gap year might be financial. Again, I'll throw a little statistic out for you. At the average student who finishes Howard finishes with close to $200,000 in debt. And that includes their undergraduate and their medical school debt. And that's very hefty. So some people decide, to work and tutor and do other things, scribe, and, and kill two birds with one stone, get some healthcare related exposure and make some money in their gap year and kind of save, save for medical school so that you can just actually cut down on your debt. And then Dr. Schofield alluded to this, that you may decide to use your gap year to address deficiencies in your application. And these may be academic deficiencies, such as addressing MCAT and GPA issues, or maybe looking at strengthening the prerequisites, or maybe you didn't have the opportunity because your major was not in the sciences and you actually need that extra time to knock out the prereqs. I was looking at a applicant's file yesterday, and they might have been a philosophy or English major who decided to go into medicine maybe in the middle of their undergraduate career. Well, that was just not enough time to take 2 bio, 2 chem, 2 organic, 2 physics, so they needed to take a gap year to fulfill those prerequisites, and that's obviously what they had to do. And then obviously, you may use that gap year to fulfill the various experiences that were alluded to in the earlier presentation. You may also decide that, hey, I just did not have the time to do some good research, or I'm involved in some great research and I would like to see some of those projects come to fruition and get some papers out of it because I feel like that would really add to my application, and you may choose to use your gap year for that. And as mentioned previously, the healthcare related exposures are very, very important, as well as your volunteer activities. The master's programs, so these are post-bac programs essentially that are going to be offering you a degree. And I think this is very helpful, particularly if you may be a little bit still on the fence and you're not sure that medicine is going to work out for you or that you want to pursue it, because I think coming out of these programs with some sort of degree under your belt is going to be very helpful for you down the road. So who may be the post-bac programs, what type of student may be looking at doing a post-bac program? And we've kind of alluded to this a little bit, but the applicant who was not initially pre-med, who needs to get that strong science background and show the admissions committees that they can handle the work. Maybe someone who had a low undergraduate GPA in their pre-med courses, who now again need to show the committee that they can handle that science work. Or they graduated so long ago that there are actually some schools who have a time limit on their prereqs. We do not at Howard, but obviously we're concerned when somebody is out 3, 4, 5 years. But in some schools, your prereqs can actually become outdated and you may be required to go back and do them. Reapplicants, many times doing a post-bac program is a way to strengthen your application, because when we have somebody who is reapplying to us for the second time or the third time, we kind of really scrutinize those applicants to see, well, what has changed? If we reviewed your file 2 years ago, and you were either waitlisted or maybe you didn't even get an interview and now you're applying again in this new cycle, what exactly has changed in your application? What have you done in the interim, to make us think that this, this should be the year? And then there are folks who are non-science majors in college. And I put a little asterisk next to that one because I'm a little bit on the fence on this one. We actually value people who are not science majors. So we have folks who are not science majors, but they complete their prereqs within the 4 years. There's no reason for that person to take a gap year to do anything else if they completed their prereqs and they have all the other requisite experiences and exposures. But sometimes, as I mentioned before, someone who is not a science major may have decided a little bit later on to pursue medicine, and they just actually need that gap year and that time to do a post-bac program and to have a competitive application. So what are some of the benefits of some of these programs? You have typically good access to advisors. Many of these programs are designed for students who are trying to get into medical school. So the folks who are teaching the courses and the folks that you come in contact with are good sources of information for you. Some are linked to the medical schools that you complete the program at a certain level and then you may be guaranteed an interview, maybe not guaranteed admission, but guaranteed an interview. Some of these programs do have built-in volunteer activities, opportunities for networking, and may give you some flexibility in being able to do some work at the same time so that you can complete the program and still be at least making a little bit of a living. coursework tends to be accelerated. And I think as Dr. Schofield mentioned, many of them will include some MCAT preparation, which is a huge, huge benefit to participating in these programs. Some can be pretty expensive. I would suggest that you take a look at state programs. There may be financial aid opportunities in some of these. And some do award a certificate or may actually put you on track to get a master's degree at the completion of the post-bac program. Undergraduate versus graduate, obviously, if you did not have your prereqs, then I think the post-bac undergrad courses are certainly reasonable. But if you completed all of your science prereqs in your undergrad career, I think it's much better to look at graduate level programs because that makes the admissions committee feel a lot more comfortable in terms of the rigor of the work and the feeling that you're ready to handle the med school curriculum. Final slide. So will a post-bac or a master's program even matter? So I think, again, this is one of those, it depends. It depends on, well, how well did you do? And when the admissions committee looks at these programs, they will look at the types of courses that you took in the post-bac or the master's programs. How well did it line up with medical school courses and how well did you do? Some of the local programs here in DC, there's one called the G-Squared program, which is a combination between Georgetown and George Mason. So we have quite a number of students in our program, in our medical school, who did the G-Squared program. So we're actually very familiar with their curriculum. So we know that if a student gets a certain grade in the G-Squared program, we kind of know what that actually means, So, I would suggest to you that, you're really talking about getting A's and B's at a minimum when you do these post-bac programs, because I think most admissions committees, recognize that getting something below a B really doesn't mean that you've truly mastered the material. But again, will the post-bac matter? How well did you do? Did you complete your prereqs? And did you demonstrate the ability to handle the advanced material? All right, so thank you very much. I will stop sharing. Oops, I forgot. Dr. Schofield put together this excellent set of resources that I tagged on at the end of my presentation here. And Frank, I don't know if you'll be allowed to send these websites out to the students so that they can use these in the near future.
Yes, we'll make sure that we send those out.
Okay, I'll stop sharing now.
Okay. Before we go on to some more questions, I did want to go back because I saw her question earlier. Karen Velez had a very important question about international students. Karen, are you still there? Would you like to ask your question out loud?
Hi, so my question was, like, as an international student, obviously for us it's just hard to get into undergraduate.
Tell us where you're from.
I'm from Colombia, South America.
Okay.
And I also attend Georgia Southern as McKinsey, also the Savannah Armstrong campus. And I'm just wondering, because I've been to a lot of meetings with like schools for med school, and they always talk about like the regular requirements, but I know that we also have like extra requirements. So I was just wondering like how we can stand out, like what's the best way to like approach a medical school?
Excellent question. Excellent. Dr. Rose, you want to tackle that first?
I guess I'll try to tackle it just from my Howard experience. So I'm assuming that Ms. Velez is like an F1 student.
Yes, sir. That's correct.
Okay. All right. So we do accept visa students in the College of Medicine at Howard. We have a number of students in our university in the undergraduate campus who are from the African diaspora, from the Caribbean and so on. And there's always going to be a certain number of students that we take that are visa students. It is a small number for us. We accept a class size of about 120 each year. And I would say less than 10 of those students are visa students. We look at their applications the same way as every other student, but recognizing that these students are, there are going to be difficulties with not being able to get financial aid, and they have to be able to pay the tuition on their own. because they're not eligible, at least for us, not eligible for scholarships until after the first year. So we have to kind of put all of those things into play in terms of choosing a visa student. But we will look at the student's application just like everybody else's. I don't feel like, at least for us, a visa student doesn't have to have a higher MCAT score or something more experiences in their application to necessarily stand out. It's just that we are limited in terms of how many visa students we can take every year.
Dr. Schofield?
Hi. So at the Ohio State, we don't accept students that require a visa. So I haven't had direct experience. But I did answer your question. And I basically thought the same, like, you should draw from some of your own personal unique experiences. I think being an international student, I mean, you automatically come with a certain uniqueness that you need to, that's that diversity piece that I was speaking to. Recognizing that, okay, I'm different, and let me explain why my difference is going to add to your program. Let me explain how my different background has influenced me to want to go into medicine. And not every healthcare system is the same. And if you're coming from South America, then there are different healthcare systems that exist there. And maybe in your personal statement or in your interview, talking about how recognizing how your healthcare system is its positives, its negatives, and how that's driven you to want to come to America and bring back this, first world healthcare to your training, to your community. I mean, you can really kind of sell it as long as it's something that you believe. But I think it's hard when you don't recognize how unique you are. And I think sometimes it takes sitting down, looking in the mirror, and really asking yourself, why am I unique? What's special about me?
Well, I think Dr. Schofield and Dr. Rose both just hit it right on the head. And it's good to see that most schools value diversity now. But as Dr. Rose said, there are some restraints put on by the schools that they can only accept a certain amount. So then it's up to you or up to your mentors to help you find out those schools that do accept, a large number of students. But once you find those out, that you should have every opportunity to get accepted. And as Dr. Schofield said, even some uniqueness about you that you bring, that's what you have to highlight. And that's true of everybody on every application, that what is unique about you that you bring something different to the table. We're going to answer some more questions, but I want to go for a second to one of my mentees. Her name is Sonia Randolph, and I'm going to let her tell her story briefly. And I asked her today, she's actually a first-year medical student. I'll let her tell that, but I wanted her to give her take on, she did a post-bac master's program, and I wanted her to just kind of comment on her experiences on that. So, Miss Randolph.
Hey, Dr. Jones.
Hello, how are you? You still smiling? You must be doing okay.
Yes, sir. I was in another class meeting real quick before our town hall. How are you?
How are you? And this is day what of medical school for you?
I think it's been like a month and a half. We started July 1st.
Okay.
We started July 1st, so we're in there.
Tell us briefly about your experience, as much as you want to share with us. The difficulty you had getting into school initially, but then why you chose to do a post-bac program, and what were some of the benefits from that?
Right. So I did my undergrad at the University of Alabama in Tuscaloosa. I definitely I wouldn't say that I was not capable of doing the material that I was taught, but I don't think I was as focused. I definitely didn't use the resources that were available at my school, whether that be tutoring, going to office hours a lot of the time, sat in the back of the class a lot. Didn't pay attention as much as I should, didn't, like I said, use those resources. So I ended up falling behind quite often in some of my classes. And when I graduated, my GPA wasn't horrible. It was enough to graduate, of course, but it wasn't good enough to get into school. And not only my GPA, but my understanding of the material to be able to do well on the MCAT to get into school, it wasn't there. I wasn't at the level I needed to be. So what I ended up doing was going to Georgia State University and did their master's program in Masters of Biology and Medical Sciences. I did take some time off from school because I still felt like I wasn't, oh, hold on one second. I don't have my other computer muted. But I did take some time off from school before I went to the master's program. But I definitely did some other things. I became an EMT for Grady Memorial Hospital just to get my kind of feet wet in patient care, and been working with them for 5 years. But the master's program was designed to kind of mimic your first and second year of school. So I definitely was interested in a program like that. It was in my hometown, and getting into the program, they offered classes like histology. They offered a cadaver lab called surgical anatomy. They offered a medical anatomy course that was really good. They offered a lot of different medically related courses that I would say have helped me tremendously so far in medical school. We haven't started the organ systems part of our curriculum yet, but we're in like basic principles, dealing with a lot of biochemistry and stuff like that. So those courses most definitely helped me to gain a lot of understanding and really show myself that I could do the material that I needed for medical school. So I ended up going there, got a much, much better GPA, took the MCAT, didn't get in the first time, didn't even get in the second time, honestly. A lot of the second time was due to my interviewing, but the third time I did get in, raised MCAT scores, good, really good GPA, and so I ended up getting into school.
Okay. And Sonia is one of my mentees. Can you tell me a little bit about your experience with Pre-Med Solutions, how we were able to help you?
Most definitely. So I met
And this is not to brag about Pre-Med Solutions. This is to talk about mentoring and how a mentor can help you.
Right. So I met Dr. Jones through one of my church members, and she actually told me about his Pre-Med Solutions program and how they were having a meeting. I think it was like within a couple of days, they were having a meeting about shadowing opportunities. So I went, and it was the Atlanta Medical Association, and offering different African-American prominent physicians to be able to have medical pre-med students shadow them in the program. So I immediately went. I was very interested. I didn't have much shadowing experience, so I was so elated to be able to go there. Met with Dr. Jones. I shadowed his wife, Dr. Bussy Jones. Actually, she was there answering any questions I had about interviews, letter of rec, like what I need to be doing to improve my application from year to year if I didn't get accepted, kept a relationship with them. I also shadowed a physician at Grady named Dr. Higgins. She was very helpful, wrote me a letter of recommendation as well, helped me with anything that I needed, any questions I had, and several other physicians that I got to shadow and see different surgeries. I got to shadow some pediatricians, so it was just kind of like a week-to-week kind of rotation, and you got to keep in touch with these physicians all over the metro Atlanta area to be able to have that relationship if you didn't have one with the physician already, and to see different specialties. And that was really special to me. So I definitely kept in touch with Dr. Jones and Dr. Bussy Jones, and I went to his boot camp, his application boot camp the year I got accepted, did some mock interviews with some of the they were medical students at the time, some of the medical students, and they really gave me some really good feedback on my interview skills. I got feedback on my personal statement. I got feedback on how to get, reach back out to professors, because it had been a while for me graduating from school, how to reach back out to them to get letters of rec and things like that, and just a lot of different mentoring and things that I've received from Dr. Jones and the Pre-Med Solutions program. So I'm here, and I'm doing well. I got an A on my exam.
All right. That's just to highlight the importance of mentoring. If you don't learn anything else tonight, two things. One, get you a good mentor somewhere. And it's a little bit unique. She's here in Atlanta. And so we have a lot of positions to choose from. Everyone doesn't have that luxury, that opportunity, but still you have to try to find you a mentor somewhere. That's one of the most important things. And also go to the AAMC medical student, pre-med student section. That is so helpful. They have so much helpful information, and that's on the resource page that Dr. Schofield and Dr. Rose did. Those are two of the most helpful things that you can do. Sonny, they want to know, there's a question on what med school did you go to?
I'm at Morehouse School of Medicine. I also had an interview at Mercer, but my first choice was Morehouse. So I let that interview day go, and I'm at Morehouse now. And Dr. Jones also mentored me when it came to my MCAT scores. I was doing a lot of just review prep instead of like practice questions. And he was very adamant about me doing a ton of practice questions every day. And so that is another reason why I was able to improve that score, really practicing a lot.
Okay. Are there any quick questions for Sonny? Because she has got to go back and study. Any quick questions? Real quickly, how do you improve your CARS score?
CARS, I'm going to admit for me, CARS was my lowest section. My highest was biochem. CARS was my lowest, but I did improve from the year. I actually took a Kaplan course that helped me with CARS. So I would definitely suggest, I know Pre-Med Solutions or Atlanta Medical Association sometimes have discounts, or maybe your schools have discounts for prep courses and things like that. But it definitely helped me as far as having access to a lot of different practice passages for CARS and different things. Because Kaplan for me was a little harder than the actual exam. So that helped as well to prep for the real thing, and definitely take the real practice exams that they offer to you that you can pay to get.
Okay. Well, thank you so much. Go back and study so you can get another A. We appreciate it.
No problem.
So,
Good luck, you all.
She's a shining example of what you can do if you just stick to it and don't give up and get a good mentor. So thank you, Sonia.
You're very welcome. See you later.
All right. To just jump back for a minute, Dr. Rose, you talked about the master's programs, and we know that not all master's programs are created equal. Can you just kind of comment on that? You kind of alluded to it a little bit earlier. What are your thoughts like about a master's in public health, a master's in nutrition versus a master's in immunology or biochemistry or something of that nature?
Yeah, so I mean, we definitely would want to see a master's in a heavier science background. The admissions committee is going to look a little bit more favorable on that. Now, I got to tell you, I think when I was on one of your previous sessions, I heard you emphatically tell folks that they should not get a master's in public health. And I don't know if I feel as strongly as you do about that. We have a pretty diverse admissions committee, which includes some people with public health backgrounds. So we can't really poo-poo that too much, on the admissions committee. So we will look at it. But I agree with you in the sense that it's going to carry more weight if it's in one of the harder sciences. There's no question about that. In terms of how the admissions, the majority of the admissions committee is going to look more favorably on a master's that is in the harder sciences than something in public health or nutrition, without question. But sometimes we have people who did an MPH, but they didn't do it necessarily as a gap year or something to help them get into school. This was an interest area of them. Their undergraduate GPA is totally fine, and their MCAT is totally fine. So the MPH was just their area of interest, and I think that brings some diversity to the medical school class.
Right. Oh yeah, I would agree with you in that situation. But oftentimes what we see is a student doesn't have a good GPA and maybe mediocre MCAT, and they think, oh, well, I'm going to get a master's in public health, and that will take the place of my GPA or the MCAT. But I definitely agree with that. I have my MPH, and so I definitely agree with you that there is value in getting the MPH. What about committee letters versus a group letter? Which one do you all use at your institutions?
We accept either two, we have a combination. We will accept one committee letter or two science letters. And then similar to what I heard Dr. Schofield mention, we encourage other letters, whether it be from folks you worked with in scribing, research, and so on. In the last year, we also agreed to allow one science letter to be substituted with a research letter, as long as the student did at least a full semester's research with that particular person. So they can have one science and one research letter, but it had to be, some significant research, a full summer, a full semester, or better yet, even a full year of research, and they can use that to substitute for one of their science letters.
Dr. Schofield, any comments on that?
We do accept committee letters. Our basic requirement is 2 letters, one of which has to be, 2 letters from professors, one of which has to be a science professor. But as far as a committee letter goes, I mean, even within that committee letter, there should be a science professor who has contributed to that letter in some way. It just can't be all like English and sociology and jazz 101, so it has to contain a science professor.
Okay. Unique Hayes, is that the Unique Hayes that I know from Spelman? Maybe this is a different Unique Hayes, but Unique, would you like to ask your question face to face?
Hi, Dr. Jones.
Hello. How are you doing?
Good. How are you?
Good.
Hi. Hi. Well, I'm Unique. I'm originally from New Orleans, but now I'm in Ohio working. I had a question for you, Dr. Rose. What are the characteristics of the application for the students accepted into the preliminary academic reinforcement program in Howard?
Sure. So it's called a PARP program, the pre-academic reinforcement program. So you actually have to be accepted into the program by the admissions committee. It's not something like you can apply to individually. And typically the students that will get accepted into the PARP fall into a couple of categories. It may be a student maybe there's a mismatch between the MCAT and the GPA. So the committee is a little bit conflicted as to, is this person going to have some struggles or not in the med school curriculum? And then there may be a suggestion to say, okay, let's bring them in as a PARP student, which is 6 weeks. It's a 6-week program that occurs about a month before the med school actually starts, where they will duplicate the first 6 weeks of our med school curriculum. And they have to pass. They actually have to pass the PARP program to then matriculate. So it's a conditional acceptance. The other type of student that may fall into the PARP category may be a student who has been out a little bit since their undergraduate science courses. And maybe they took 1 or 2 science courses here or there, but it wasn't a formal master's or post-bac. But we like everything else we see about the person. We think they're going to be a great fit at Howard. But again, just a little bit uncomfortable. Are they going to be ready to hit the ground running on day 1 with the science load? And we would say, okay, this person has been out a little while. Let's give them an opportunity with a conditional acceptance through PARP. So it tends to fall in those couple categories. Somebody who's been away from the sciences for a while, or maybe there's just some concerns about their academics, whether it was on the MCAT side or the GPA side, that's making the committee a little bit concerned.
Okay, thank you.
Unique, call me soon. Let's talk.
No, I will.
All right. Question from James Ulis. James, are you there? Not a question, but a comment. And I'm sure a lot of people want to hear what you have to say about this. James, are you still there? All right, maybe he's not there anymore, but he says that if you want to want an inexpensive MCAT class, reach out to him, and his information is there in the chat. We do have a relationship with Kaplan that you can get a significant over 50% discount if you register for Kaplan through us. The problem is we have to always get 15 students to start a class at one time. 20 students.
Dr. Jones?
Yes. Okay. Here's James.
Oh, sorry. I was trying to get my mic up.
Okay.
Yes. So for this program that I'm currently taking right now, it's a
Let's
program.
See your face.
Oh, my face. Okay.
Tell us where you're from. Okay, we see you. Go ahead.
Oh, you see me? Okay, so my name is James Ulysses, and I currently attend Morehouse College, and I'm a senior, and I'm going to be applying this year to medical school, and I'm taking a MCAT course, and her name is CM, and I don't know if everybody know I don't know if you know Dr. I forgot. He's a cancer biology.
Oh yeah, I know who you're talking. Yes.
Yes. So he informed me about this program, and it's very inexpensive, and it's around $200 a month. And she has a comprehensive course with a bunch of other instructors that you come around 7 o'clock, 7 p.m. to take MCAT. To take MCAT classes and then you have homework, and then she assess your progress throughout the class for a period of 4 to 5 months. And basically, like, her class was very inexpensive from the Kaplan class, when Kaplan charges around $3,000 to $4,000 for their course. So it's really been helpful, and she really does care. I mean, she really puts time and effort in her program. So if anybody wants to gain any information, I can just email them the packet.
Is it a way to do that virtual, or you have to be here in Atlanta to do that?
Oh, for the MCAT program?
Yes.
No, it's virtual actually. So missed class today, but every day from Monday to Friday, 7 p.m. You go on Zoom. And basically from like 7 to 10, you're doing MCAT classes, and then after that, then you're going to be doing homework from the Berkeley Review. And she provides everything. You don't need to. I asked her, do I need my books? Do I need anything? She has everything comprehensive in one setting. So the only thing that you need would be the AAMC materials, and if you want to supplement with other questions other questions like UWorld, like 1900 questions, that'll be in your favor too.
Okay. Well, we appreciate that, and we have your email address, so if you want to reach out to James, please do.
All right. Thank you so much.
Yeah. Let's see. I saw another question a minute ago. But I'm curious, Dr. Schofield and Dr. Rose, one thing that I've done, I'm like you all, I'm sure you've written a lot of letters of recommendation for people. And when students come to me now to ask, I actually ask them to write their own letter of recommendation. Do a template of a letter of recommendation for me. Let me know who you are, and then I'll go back and I'll edit it. I'll add the important parts. I'll take away parts that I don't think are true about you. But do you all ever do that? I found it to be very helpful, and actually you can get your letter a lot faster if you do that.
I've never done it for medical school, but I have done it for when people are applying to other programs or what have you. I'll just have them write it, and then I'll edit from there. Interestingly, if that same student does ask me to write them a letter for med school, I'm clearly cutting and pasting some of those things from that letter onto the med school letter. But I've never had someone write their own med school letter.
Dr. Rose?
Yeah, similarly, but the ones I get hit with most in my position, we have students who are applying for various scholarships once they're in medical school. So I will ask them to write a paragraph about themselves, particularly when it's a first-year student, because at that point, some of our students are applying for scholarships within the first month, so all I know about them is, their application to med school. So I'll ask those students to write a paragraph about themselves and incorporate that into the letter.
Okay. One of you, I don't remember which one, talked about the difference in volunteering and shadowing. And can you talk a little bit about this virtual shadowing now and how that's going to be looked upon by admissions committees?
I must say I don't know much about virtual shadowing. I'm not familiar with it. So if Dr. Rose can talk about that. But I do think that all admissions committees are being a little bit open-minded about the impact that the COVID-19 pandemic has had on the ability for students to obtain certain experiences. And so we definitely are going to be open to any unique experiences that students have had and what they've gained from those experiences. So.
Yeah, I agree. Not too familiar with virtual shadowing. I mean, I know of students who are doing their research in a virtual fashion. What we did was we just added a question to our secondary application, asking the student whether they feel that their application has been impacted by COVID. And interestingly, so far, it's kind of half and half. There are some people that said, no, to that question. And then there are others who gave us a pretty lengthy paragraph as to which volunteer experiences they got shut out of during that summer or various research experiences, so that we could kind of take that into consideration as we view their application.
Okay. And just to comment on the gap year, I used to be against gap year. I used to tell students all to know, there's no role for a gap year. But I've changed my opinion about that. And actually, students have changed my opinion about that. And where I see it very helpful is in that student that was taking such a difficult load and didn't really have time to adequately prepare for the MCAT. And so they decide, well, I'm going to graduate and then study during that gap year and take the MCAT. And I've seen some students make some remarkable improvements. So there are unique, just as you said earlier, Dr. Rose, every situation is different. And so you have to really find someone that you can bounce that off of, whether or not it's a good idea. In any closing comments that you all have, I do see in here someone talking about the First Fridays at Howard. Dr. Rose, you want to comment on that?
Certainly. We had our first virtual First Friday for the month of August. We are trying our best to have it duplicate the same experience as when students do come on campus, which is a brief presentation by myself, followed by a presentation by our admissions director, and then we leave the prospective applicants with the students, and they get a tour, and they get a panel discussion where some of our students kind of share their stories with them and give them the applicants an opportunity to ask any questions that they may have. So we were pretty much able to duplicate that, with the exception, obviously, of the tour. But we did have a student panel discussion for the first one. We just completed a video of the tour. And so that, once it's fully edited, that will actually be added to the September. Hopefully we'll be able to air it with the September First Friday, to give the students a feel of being on campus. Yes, I saw that Jody Spencer was asking the question, and yes, it is a great way to to experience life at Howard, particularly the student panel, because that's an opportunity for them to talk to our current students.
Okay, and we're getting ready to close out in just a minute, but as you mentioned, the students, talking to other medical students is probably the best thing that you can do. They can give you so much information. So reach out to them. If you don't know any medical students, you can reach out to the SNMA, the Student National Medical Association. They have medical students that are more than willing to help mentor you and answer any questions that you may have. That is an invaluable resource. We just want to remind you that next week we will be having our virtual recruitment expo, and we're going to have about 14 or 15 medical schools that have a good track record of accepting underrepresented minority students. And so please, we want you to support that. Tell all your friends about it. We want this to be very interactive. You have a little bit more time to answer questions. And before we go, for each of you, if a student came up to you and just asked, what's the best way to strengthen my application, what would you all tell them? Other than being good in the first place.
I think it's always important to receive feedback. So if you found out that your application wasn't strong enough, either from not getting into med school the first time, or someone else reviewed, like your advisor, usually people have like pre-med advisors at their school. I think it's important when you get this feedback to act on it. And before you resubmit it, get that set overview again, preferably from someone that's a part of an admissions committee. So prior to submitting your application, at least at Ohio State, we're very open to talking to you about your application, things that we would look at that are strong or weak. I do that all the time. And so I encourage students to reach out before you submit so I can review your personal statement, those kinds of things. Anyone on our admissions committee would be open to doing that before you submit.
Yeah. And that's very interesting because not every school does that. But you say that you all do that willingly and you enjoy doing that, and all of your admissions officers are willing to do that. That's excellent.
Yeah, Dr. Capers used to hold Wednesdays with the undergrads, and he would just throw it out there, and it would be a room he would sit in, and the undergrad students would come with all of their application questions, talk specifically about, is this good, is this bad, and give advice one-on-one. And I've met with students one-on-one. There's also an intro to medicine course that we have here at the Ohio State University for undergrads that specifically goes over this as well. So a lot of support to try to help kids get into med school.
Okay. Dr. Rose?
Yeah, I think I would say the key thing is to do that in-depth review of your own application, and look for the areas of weaknesses and have those addressed. So you got to really just take a critical review of your own application. The second piece for us at Howard, we're probably not as free with the advice, only because we have found it to be a little bit troublesome. So we will give general advice about applications and so on. We find that when we start getting very specific with people's application, they kind of come back and say, well, listen, I corrected this and I corrected that and I still didn't get in, or so. We only have 120 spots, so not everybody is gonna end up being accepted. So we find it a little bit troublesome sometimes to give each person specific advice. We just don't have the staffing and the ability to be able to do that. So we will refer students back to their pre-health advisors, but we can give them some kind of global advice, in terms of saying, hey, these are some areas that you may want to look at, but find it difficult to get too specific.
Okay. All right. Well, we want to thank you all again, and we'll see you next week. And Dr. Schofield says she just can't wait to be here next week. She'll be here bright and early at 7 o'clock. And this is PM. So we're looking forward to next week having some admissions officers and some other individuals answer questions specifically about your institution. And the students have a lot of questions. Just to kind of recap on what's still remaining on the schedule, on September 1st, we're going to be talking about choosing the right school. We hope to have someone there from a Caribbean medical school. We would definitely have someone there from an osteopathic medical school. What is osteopathic medicine? Should I apply to a DO school? September 8th, the next week, we're going to talk about the personal statement and supplemental responses, and also the interview. And the following week, we'll be talking about how do I survive medical school? Once you've gotten in, how do I survive it? And then what do I do if I don't get in? So we're going to kind of circle back to a lot of the things that we've talked about over this series, but just want to kind of give you a heads up. Please let your friends know that we're here. We're doing this for you. We want to help you trying to develop the pipeline of the next generation of Black and Brown physicians. So please let them know what's going on, and we look forward to seeing you next week. Thank you again, Dr. Rose and Dr. Schofield. We really appreciate you being here. This will be, there's a question about how can you view this. We will have this up on our YouTube website, and we'll see if we can actually send the recording out. I don't know if that's possible. This might be too large to do that, but we'll try and figure out how else we can do it. But it definitely will be up on our social media pages. But thank you again, Dr. Schofield and Dr. Rose.